Hello everybody, my name is Georgia Hatzidimitriadis and I'm going to discuss the proper technique for obtaining a chest x-ray on an adult patient. I have worked in a hospital for 2 years as a radiology tech and I have performed many of these examinations. The first thing I want to briefly discuss is what is a chest x-ray. This examination involves exposing the entire chest to radiation to produce an image. These are commonly used to detect abnormalities of the lungs, the heart, aorta, and the bony structures of the chest. Now, when the patient presents themselves in the radiology department, we ask them to remove all their clothes from the waist up and to put on a gown. Also, we want to make sure that they remove any metallic objects such as jewelry on their neck and their chest. These objects can block the x-ray penetration and cause artifacts on the images. We want to ensure that the procedure is done safely. Now, what do I mean by safely? We want to make sure that we always apply a lead shield on the patient's genital area. And if it's a female, we always want to ask if she's pregnant. If she is, we need to notify the physician and see if he still wants to proceed with the chest x-ray. Although radiation is minimal, any exposure to the fetus could be potentially harmful. Next, we ask the patient to stand and face the x-ray plate, which contains the film. We make sure that the patient is positioned and centered properly, so we can make sure the entire chest cavity is exposed. We then ask the patient to take a deep breath in and hold it to inflate the lungs to their maximum, which will increase the visibility of the different tissues within the chest. The x-ray settings are selected for each patient individually due to different in body mass. The x-ray is taken from a back to front or PA view, and then the patient is repositioned for a side or lateral view. And we always want to make sure that the patient's arms are up so they don't obscure the image. If the quality of the image is examined by the radiology tech and everything is adequate, the patient is allowed to dress, and then the tech sends the images, they forward the images to the radiologist for interpretation. And this is a quick overview on how to obtain a chest x-ray on an adult patient. Thank you for your attention.